Hey folks, I got a call recently from a person looking to become a medical exercise specialist. And their comment to me was, well, where is this all going? What's all going to happen with medical exercise training? Well, folks, as you guys know, I'm the guy who started this, some 20 some years ago. And we started because as a physical therapist, I wanted to move our patients out of the clinic faster and more effectively when we're seeing a decrease in the number of physical therapy sessions. And that assault against physical therapy sessions being reimbursed by the insurance company is continuing on now in 2018, which means the need for medical exercise training is going to continue to grow. Folks, I'll tell you, in the early years, we had a lot of physical therapists that were completely against the idea of us offering this certification to fitness professionals. They thought it was a conflict of interest. They thought we were selling out the physical therapy profession. They were really pissed off. Well, ironically, about 2 or 3 years ago, a guy who had called in those early years and was so profoundly pissed off at us called up 2 or 3 years ago and actually registered one of his staff members for the program. And when I picked up on his voice and realized who he was, I was like, well, weren't you the guy that called years ago? He's like, yeah, I did. But, he says, healthcare has changed now. We need to find ways of managing our patients longer and keeping them in the clinic longer. So I figured I would try this. Wow, don't you think that? I felt validated after that. Which leads me to the point of this video. Where's this all going? Folks, the need for medical exercise training is going to get bigger and bigger. Here's the key thing. We've got to get medical professionals, particularly physicians, to think medical exercise training is the next logical step. Now think about this. You have a hip replacement, you have inpatient physical therapy, you're discharged, you go home, you have home physical therapy, you're then independent to ambulate outside the home, you have outpatient physical therapy, then it's over. So the logical step is after the hospital, home PT. After home PT has reached the goals, outpatient PT. After outpatient PT is over, the next logical step should be medical exercise training. We've got to present this out there to the medical community as the next logical step. And basically the question is, Doc, after physical therapy is over, and you don't want Mrs. Smith going to the big box gym with the big bodybuilders, the next logical thing should be a supervised protocol-based exercise program that you can communicate with the professionals offering the service. They've got guidelines in place, and you're assured that they're going to follow these guidelines. That's the next logical step, okay? Inpatient physical therapy after the hip replacement, home PT, outpatient PT. The key thing here is there's a logical step with each one, and we know exactly what the client is getting with each one. The thing we've got to do as medical exercise specialists is make sure that we clearly explain and clearly show and demonstrate to the medical professional exactly what their patient is getting or your client. Now, with that being the case, we now have to also start to think of the idea of how do we continually communicate that back to the medical professionals? We've got to continually provide them with reports and documentation, but along with that, we have to now share our documentation and our outcomes with other medical exercise specialists so we can now start looking at the dosage. How often, how long, how much, what exercise, what sequence, what were the initial functional outcome measures, how long did it take you to see a significant improvement, how long for 30% improvement, how long for 40% improvement. We've got to understand those things. So when we look at this idea of what the future holds, the future is extremely bright. We're now getting doctors that are calling us saying, we want to put this in our facility. We've got therapists that are saying they want to put medical exercise training, medical exercise specialists, I should say, in their practices. We're even seeing now that there's some independent hospital groups that are going out there trying to put these into hospital facilities. But here's the problem. We've been doing this now for 23 years plus. We understand all the nuances of the communication that has to occur between the fitness professional and the physical therapist and the chiropractor and the physician and what the insurance carrier is going to say and how it should be explained and defined. To say this, as a medical exercise specialist, you're in a unique position to chart your own course for the future. So here's the question I would ask you. How can I, the medical exercise specialist, or you, the medical exercise specialist, how can I help doctors, therapists, and chiropractors better manage their patients to positive functional outcomes based on individual conditions? What that means is stop thinking in general and start thinking about specific conditions. Total hip replacements, total knee replacement, cancer, diabetes, hypertension. The medical community doesn't look at it and say all lower extremity disorders or all sports medicine disorders. The medical community says, well, meniscal tears, ACL tears, CVAs, hypertension, osteoporosis. They look at it from a specific condition standpoint and then put the solution together. Now, what they'll do is if certain conditions are all clumped into the same category, like for instance, neurologic conditions, they may see trends with neurologic management that now can be used universally within that neurologic community. We've got to start thinking the same way. So the outlook is great. We're going to see a greater need in hospitals over time. We're going to see a greater need in physical therapy, chiropractic clinics. Hospital-based fitness centers definitely need more medical exercise specialists because right now everything we've seen has said that there isn't a good flow of communication between the physical therapist that's in that facility to the fitness professional, because the fitness professionals don't go over and talk to the physical therapist. The physical therapists don't talk to the fitness professionals. It's just gridlock. It's almost like what we get in Washington, D.C. with Congress and the Senate and everything. So what we have to do is figure out ways around this if we're going to move forward. Now, there's going to be also a need in corporate fitness settings. Employers are going to start looking at medical exercise training as an option in helping manage some of their clients. One of our MESs, Stan Johnston, over in Bristol, Tennessee, has done a lot of work working with some of the factories there in his community. We're going to see a need for medical exercise training in the athletic arena as far as managing clients after physical therapy, athletic training is done. There's going to be a need there, especially in the off season. We're going to see a huge need for medical exercise specialists in active adult or senior living communities. We've got one of our MESs, Yuli Balani. He's in New Jersey, and Yuli provides his services in private independent senior living communities, and he's doing a booming business right alongside the physical therapist. The key thing is this: medical exercise training is not designed to steal patients from physical therapy. It's not. It's not designed for that. Folks, I'm a physical therapist. When we put this together, we wanted there to be a true delineation, and that patient that's discharged from physical therapy because either their benefits have run out or they've received the maximum benefit from physical therapy, that's the person we're talking about. That becomes your client. And notice the distinction I made between patient and client. There's a huge need, a huge and growing need to manage that individual after physical therapy is done. Insurance carriers realize they have only gotten this person to a certain level with regard to their rehabilitation. They don't want to keep paying for physical therapy. They want something different. They want something that's more cost effective. They want something that can be managed for a longer period of time. So please don't make the mistake out there as a medical exercise specialist to say, hey, I'm going to charge the same thing the physical therapist does. No, wrong answer. That's going to get us all in trouble, because eventually the insurance companies are going to scrutinize you so far and so long that they're not going to pay a dime. Let's be fair, because folks, the one group out there that has more lawyers, has more information on us than anyone else are the insurance carriers. So let's play fair. Okay, look at it this way. Do you have to charge the same rate the physical therapist does? Do you have the same overhead cost? Or is it just a matter of, I just want to make the same money? Well, if you want to make the same money, go back to school, get $100,000 worth of student loans, stay up all night studying, take the board exam, and be a PT. If you don't want to do that, be proud of being a medical exercise specialist and say, hey, I'm going to set a fair market rate price based on the value that I offer this individual and the results I produce. Here's my cost. And folks, I guarantee you, if you have a fair cost that allows you a profit, over the course of the next 5 to 10 years, more and more insurance carriers will start to pay because they're going to see what you're producing as far as outcomes. So the future is bright. There's a need almost in every aspect of American society for you. The same thing can be said of the Canadian landscape. The same thing can be said in Europe. The same thing can be said in Australia, all over Asia, because our populations are aging. There's a huge need, but we've got to provide professional services driven by professionals to produce professional outcomes. So there's a huge need, folks. It's just going to get bigger and bigger. And I've sat here from the very beginning. We offered the very first certification, and I can tell you, we're seeing some things that are amazing out there. And we're seeing people get insurance reimbursement. We're seeing referrals from physicians. We're seeing doctors contacting MESs to find out how they can work in a more collaborative manner. We're seeing physical therapists becoming more receptive to the idea. So this thing is growing, folks, and it's just going to get bigger and bigger over the next 2 decades. Now, I notice I said next 2 decades. By the end of that second decade, the need for medical exercise training is going to drop off because the baby boomers. I'm the tail end of the baby boomers. I'm 56. I was born in 1961. The baby boomers are from the 1950s to 1965. Okay? Which means 20 years from now, I'm going to be 76 years old. By that point, let's be honest, the life expectancy for the average American is somewhere in their mid to late 80s. So we're talking about, I got a life expectancy now for another, say, 30 years. By the time my generation starts to get to the point we're expiring, what we're going to find is the need for medical exercise training is going to significantly drop because our generation is huge. So your opportunity for this is over the next 30 years because me and my compadres, the other baby boomers, are driving this healthcare trend right now. We realize we've had the surgery, we got the hip put in, we saw physical therapy, but we want to do at 56 what we were able to do at 36. I want to still play golf. I want to still be able to go out and dance a little bit. Yeah, Dr. Mike dances a little bit. And I still want to be able to do those things. But along with that, I still want to have a quality of life. And the therapist told me there's so much they can do. The insurance company cut me off. Now I'm going to come to you. And that driving force is the thing that now is pushing medical exercise training, will push it for the next 30 years. So all the best to you. Good luck to you. Please remember, exercise is the key to long-term management of most medical conditions, and exercise is really the best kept secret out there. All the best. Talk to you soon. Bye-bye.